The program that you're about to hear, the Wisdom Table, does not reflect the views, attitudes, whims, needs, or any other proclivities of the management of the community center at the James Weldon Johnson houses, nor that of the administration of the housing complex. However, the program does reflect the research done by the participants in the program, the Wisdom Table itself, and of course our guests. And we have one of our star pupils. We always have to teach this person something. And that person is on the line, and she is here for another session where she can learn from us. But we're going to let her talk first, see how much she knows. It is Dr. Velva Boles of Louisiana by way of North Carolina. Dr. Boles, thank you for joining us on the Wisdom Table.
Thank you for the invitation. I always look forward to it.
So we're going to start with some everyday ailments. That is what we hear on radio among friends and associates, and that is, we want to talk about cancer at the top. That is breast cancer. We want to talk about prostate, and then we're going to go into a couple other areas, and let's start with breast cancer and the understanding it and the treatments of.
Well, first of all, we should know, or many do not know, that there are 8 different types of breast cancer. There's 8 different types because there's 8 types of tissue that make up the breast. And each one of those cells in the breast can give rise to cancer. This is so important when we start to think of the treatment of cancer. One of the mistakes a lot of people make is they talk to a friend, a neighbor, mother, sister, brother, because men do get breast cancer, by the way, and they find out how do they treat your cancer. And that somehow empowers them to go to the doctor and tell the doctor, this is what I want you to do. That is a mistake, because the type of cancer your sister, mother, cousin, brother may have had may not be the same cancer that you have. And each type of breast cancer require a distinct type of treatment. You hear in some cases they take the entire breast off. That's a radical mastectomy. Sometimes you hear they did a lumpectomy. Sometimes they did chemotherapy. All of the different treatments reflect the different type of breast cancer. The most aggressive one, and the one that you may hear a lot of in the news, has to do with a genetic marker that they have been able, in studying DNA, to find that there are certain types of genetic coding that gives a woman a higher likelihood to develop breast cancer. Now, this percentage of genetically determined breast cancer is very low. And they can be very specific. They do a DNA test, you have the gene, you can make a decision to have a radical mastectomy, which means remove all breast tissue, and never have to worry about getting that cancer. That is a very small percentage of people who have breast cancer. So when you go into breast cancer screening, they'll do a number of things. They'll ask you, anyone in your family have cancer? And if they can get sufficient information to suggest a genetic link, then they'll do a genetic marker study. But the most predominant and the most reliable way to identify breast cancer is by examination. So I usually teach my patients, young women and men, how to examine their breasts to find any kind of lump or cyst. So breast cancer is a very diverse disease and not as singular as it sounds when they just say the word breast cancer.
Okay, all right. So with black women, is there an actual difference of occurrence of cancers relative to your racial group?
Well, the issue with black women is usually breast density. That if you are a person who carries your weight in the upper part of the body, meaning that you were a young woman and you may have been a C or D cup, And then when you came 40, suddenly you are D and your F and your breast tissue keep getting bigger or your cup size keep getting bigger, then you have what we refer to as dense breast tissue. And as we've discussed off and on, Brother Leroy, techniques of early detection were not designed for dense breast tissue. Surprise, surprise. So more than 50% of obese or heavy set, as we use in our language, Black women can go in and have the evaluation. When you go in, they press your breast and they do the breast exam. 50% of those patients can have cancer missed because of the detection device does not do a good job in dense breast tissue. And that is one of the reasons many Black patients have advanced breast cancer when treatment is sought.
Okay.
So the best way to detect breast lumps and bumps is in self-examination. And it should be taught. It is a very simple procedure, but it has steps. What do you do first? What do you do second? And I usually recommend that this exam is done in the shower and in bed. And though this may sound funny, a number of breast lumps are discovered by your significant other. If you have a lover, they probably know your breast better than you do because they pleasure themselves in touching your breast, so they know when something goes wrong.
Right. Okay. Question from the table. The table is stunned.
I know, I always need those thoughts so I can think about it. Let me just tell you how simple it is to do a breast exam. If you're standing, when you're standing in the shower, the woman should put, I usually start on the right hand. If you're right-handed, put your left hand on your head. That allows the breast tissue to project maximum. So left hand's on your head, right hand moves underneath the breast and it cups it. And you start to press inward towards the nipple and move the hand very slowly in a dragging motion. And what you're doing is pressing against the tissue against the pectoral muscle. And if there's anything hard or lumpy like a marble, you'll be able to feel it if you do that motion. And you go around the entire breast. And I tell the patient, consider an orange. If you've ever pulled an orange, you'll see there's a hole at the top of the orange, and then it has these sections that we tear away and eat. Well, if you imagine that orange is against your chest and your nipple is that opening at the top of the orange. So as you're moving around in a circle, pay attention to each section that you massage towards the nipple and then come back to the base. Go down and massage toward the nipple and back down to the base. And that will allow you to examine each segment that's within the breast itself. So it is divided into segments just like an orange is. Mm-hmm. A lot of people don't know that. It's not just sitting there on your chest and a big lump. It actually has a real strict organization. So that's one of the things you can do. And once you've finished examining the left side, you reverse it. Put your right hand on your head and take your left hand and examine your right breast. And if you do this at least once a month, you won't let it get away from you. You'll be able to say, okay, that feels like what I'm accustomed to, no problems. But if you ever feel something tender, something sore or hard, that's when you need to go and say, I would like to have a breast exam. And usually your primary care doctor can do it, but your OBGYN or gynecologist is better trained to look for stuff like that. Many women, after they have their children, never go back to a gynecologist.
And talk about the two types of that I'm aware of. There's the thermogram and which is not used often. What's the other one? The common one that presses up against.
Well, the mammogram is the most common. That's the one they tell you that after age of 40, you should have a mammogram. But that is the one that is least sensitive to Black women. for the reason I described, that if you have real dense breast tissue, a mammogram is less than 20% accurate. It cannot show any kind of lumps or bumps or unusual tissue inside of the breast if the breast tissue is very dense. Now, they just came out with a new 3D evaluation mammogram, but you're going to understand this comment. Unless you have private insurance or you are under a doctor that has access to the most modern teaching hospital, it is unlikely that you will get the newest mammogram scan. I know here in Alexandria, the major Catholic hospital does have the new 3D scan. Well, so does Rapid. I think both hospitals have it now. But all hospitals may not offer women who do not have private insurance the ability to use the newest mammogram. But Black women do not get a very accurate reading with the standard mammogram exam.
Okay, the thermogram.
Well, a thermogram, you have to have a certain kind of tumor. See, thermal means heat. So if you have a tumor that gives off extra heat, yes, they'll detect it. And thermogram was most often used with thyroid cancer because there is a cancer that is very aggressive that gives off a high degree of heat. So if you use a thermogram, you can catch it earlier. Like I said, in the breast tissue, there are 8 types of cancer, and 6 of them give off no heat at all. In fact, they give off what's called a cold spot. So technique of exam is very important. I think the most active, the most aggressive technique to diagnose is personal examination. Young girls between the age of 13 and 15 can have something called polycystic breast. And these are young women who are not real familiar with their body, and they usually have a tenderness around the nipple around the time of their period. And they can panic when they feel this lump, and it is a lump that comes up into the breast tissue just about the time of menstruation. And this can send a lot of young teenagers into a panic, and hopefully the parents take them to the doctor, and the diagnosis will be a polycystic breast. Polycystic breast is benign, but it sometimes fools the person into believing they never have to worry after that. They'll just say, oh, I have polycystic breast. That is a mistake. Having polycystic breast does not exempt the possibility of you getting breast cancer.
Okay. Questions at the table?
Wow.
This is the Wisdom Table coming to you from East Harlem Community Radio. I'm the co-host along with a table of wisdom carriers, and that is people who call senior citizens, but I call them veterans of life. And once again, the table is open for questions. Dr. Sabi, before I talk about Dr. Sabi, the types of cancer, I'm confused about lumps, and then you see a picture of something eating away at a person. What's
Okay. When I said there's 8 types of breast cancer, you're hitting on it. The kind of breast cancer that can occur in what's called the septum or the dividing membrane of the breast, that becomes hard. And that's usually felt as a very hard ridge within the breast. And sometimes it can even cause breast tissue to stick to the wall of the chest, so it can have a deformity. You'll see the breast and look like it's stuck down to the chest. That's usually a stroma or a structural cancer. Then you have the milk duct. And breast in a woman, the milk ducts are they're always there, but they're activated with pregnancy. Well, there are tumors that occur in the milk ducts, and a woman who can be in her 40s, even her 60s, can start lactating. he can start making milk again because the cancer is controlling what's going on. So any kind of a discharge from the breast nipple when you're not pregnant or nursing should be taken with alarm. You should never say, oh my goodness, some people call it witch's milk. They have all kinds of folklore stories. But there should be no nipple discharge if you are not breastfeeding. So you can have a cancer of the milk duct. You can have a cancer of the nipple itself. It can just be on the outside of the nipple, and that's a very horrible, aggressive tumor. If you do nothing, of course, it will invade the breast. But if you see pictures of a nipple-based cancer, it will look horrible. It'll be an eroded nipple. It'll be raw. Sometimes it will be bleeding. It can be foul-smelling. You also have the underlying tissue of the breast. It's not the septum, but it's the stroma. And again, when that's infected, you will feel something like a marble. It'll be a hard stone-like, and it may or may not move when you touch it. And that's a common one in Black women. And it's usually, they'll say, well, I feel something in here. And the first question the doctor will ask is, when you touch it, does it move? If the answer is no, it does not move, that is most concerning. That's generally the most aggressive kind of cancer, and it's the one that metastasizes and has us go after the duct. And you say, oh, they took all the lymph ducts from under her arm and so forth. So just because you use one word to describe it, I'm trying to let you know it's not a single disease. There are 8 types of breast cancer. Some of them will react to hormones. If you're a young woman and you haven't gone into menopause, they may have to put you on tamoxifen or a drug that neutralizes the effects of estrogen. So different treatments for different types of breast cancer.
Questions at the table?
I was interested in your comments on diabetes.
Okay.
I think you touched on it the last time we talked, but you didn't go into it, well, I don't know if we had enough questions to ask or time, but.
Well, I can tell you the newest thing, because when I was in medical school, they didn't teach diabetes the way that I've learned it since I've been on my own. Diabetes has been recognized as an inflammatory disease. And that everybody said, okay, that's interesting, inflammatory, and the answer is yes. At one time, we talked about diabetes, and we simply talked about regulating glucose. And we blamed everything on your pancreas, which is an organ that secretes glucose. Well, recent years now, they realize that why are so many young people getting diabetes, and why is type 2 diabetes so prevalent? They recognize that mostly in the United States, because it's not, this kind of epidemic is not worldwide. It's very specific to certain groups, and extremely, as an industrialized country, it's a black eye for the United States. So what they've uncovered in all of their questioning and examination is what we eat has triggered an inflammatory response, and one of the things we see in this inflammatory response is uncontrolled glucose levels. So I ask those who've had diabetes or no family, I always ask the question, if it's a problem with sugar regulation, why do we end up cutting off someone's leg? And if it's a problem with sugar regulation, why is it so hard for something to heal? Why does wounds last so long? Right. So as these questions got asked, they had to answer. Diabetes is an outcome and not a cause. Now let me say it again, it's an outcome. Let me tell you what I mean. If you were to go out and say, jog, you ran 5 miles, and the next day your ankle swelled up. The swelling of your ankle is an outcome to your running. It doesn't mean that your body isn't causing the swelling. But you can look at it and say, the reason my ankle swelled up is I ran yesterday. Well, what they did with diabetes, they said, why is sugar so hard to control? And they begin to see the reason this sugar is so hard to control is there's an inflammatory reaction going on in this person's body. And if you ask inflammatory, that usually means infection. Well, it can mean infection, but you can have a chemical inflammatory response. And in America, and this does lead to something you spoke to me about earlier, Brother Leroy, it has to do with junk food. I'm going to give you a minute to think about that. Why would junk food be implicated in this outrageous diabetes epidemic? The answer is junk food, by definition, I mean, they're telling you what you're about to eat is junk. That's why they call it junk food. And we laugh about it and eat it anyway. Well, when you eat junk food, you are consuming chemicals that really is not food, has nothing to do with food. That in junk food, you have preservatives, you have chemicals for bright color, you have chemicals for artificial flavor, and once you have swallowed it, your body doesn't know how to handle it. Mother Nature didn't give us enzymes to digest EDTA or benzoate. We don't have the physiologic ability, so consequently, some of us, and we all react differently, will store some of these chemicals in the liver. Some of us will store some of it in the spleen. Some of us will have it to attack our pancreas. And if you attack the pancreas, you get diabetes. Because an inflamed pancreas is one that doesn't work properly. So we now, instead of looking at diabetes as a disease all into itself, we realize diabetes is a consequence. And that's why when you go to your doctor, they start talking about lifestyle. They'll say, how much exercise do you get? How much weight can you lose? And the reason we give you lifestyle questions and even lifestyle solutions has to do with our realization that diabetes is a consequence of other activities and behaviors. We can treat it, but if you don't stop what caused it, it won't go away.
I know you talked about.
And that, I mean, you might notice that they tell you eat more fruit, eat this, don't eat that, walk, exercise, and say, well, what's that got to do with my diabetes? That's why. No one has come out and said it as plainly as I'm trying to tell you now, but diabetes is a consequence, and our young people are getting diabetes at an earlier age because they are obese and they are consuming chemicals that are not food. And the sad thing is, you see all these commercials where they tell you to take this vitamin for senior citizens, this vitamin for young women. What is the joke is they took the vitamins out of your food and put these artificial stuff in, and when you get sick from eating what is non-food, they start selling you what they took out of the food in the first place.
Interesting.
Well, that
So
was.
if you were eating raw vegetables the way we did, I can remember Dad going out in the garden and coming back with radishes and other things. We'd wash it off, sprinkle some salt, and eat it. Sweet potatoes, we wash the dirt off, dry it, throw it into the fireplace and bake it and pull it out and eat it. We were then eating the actual natural food without additives. Now you go in a grocery store, they will charge you more when they say organic. What they mean by organic is we didn't mess with it. It's like Mother Nature makes it. So they charge you more. And then they charge you 50 cents for something that's called junk food, and we let our children eat it. I was in line at Sam's, and this young mother in her cart had what looked like a 5-gallon jar of these yellow balls. I guess they call them cheese puffs. There's no cheese in it. It's yellow dye, it's petroleum processed components, and they were buying it for the children as a snack. You are setting your child up for diabetes, hypertension, brain death, ADHD, all this stuff that later on some doctor or nurse is going to give them another pill or start giving them a shot, and it could all have been avoided if we did not consume the non-food. And see, Brother Leroy, what gets me it's almost like food industry is making fun of the people. If you call something junk food, what would make you want to eat it? I mean, if I stared you a plate and told you these are dog droppings, would you want to eat it?
No.
Well, if we call it junk, why do we eat it anyway? They told you what it was. They told you it is junk. And then you go buy it anyway. That's what I was talking to my class. I said, that just really gets me when I see young people paying $100 for a pair of jeans that somebody has taken a knife and cut it into rags, and then they have something on the shelf called junk, and you go buy it and eat it. There's something wrong with that. How are we calling it what it is and then doing it anyway? So that's the new information about diabetes. They no longer talk about it as a disease. We know it to be a consequence. And if you're following any kind of, some of these commercials I just have to laugh at, where they have a drug they want you to take because they ask the question, do you know that diabetes puts you at higher risk for heart attack? And when the people say, oh, I didn't know that, and they say, well, take this drug because it helps protect the heart. Well, they don't tell you the whole story. The same thing that gave you diabetes is also attacking your heart at the same time. Diabetes isn't necessarily giving you an increased risk. The thing that has caused your diabetes is also injuring your heart and your kidney. So that's the real story on diabetes. It's not a standalone disease. You don't catch it. You don't inherit it. You have to do something active that causes it. We're talking diabetes type 2. And when President Obama was in office, his wife, First Lady Michelle, started talking about MOVE, M-O-V-E. And if you remember, she was doing the hula hoop. I remember they had her on camera doing hula hoop. And then all of a sudden you heard nothing else, zero, because the pharmaceutical companies did not want her to get a following. That whole thing died. You didn't see her with hula hoops anymore. You didn't hear her talking about moves because her potential power was great enough that she would educate enough people that the pharmacies would start losing money. I'm referring to it, but I have to, brother. In my book, I give an example, and this is from 2012, so this is 6 years ago, of the trillion-dollar business of black health in America. Trillion. I didn't say billion. I didn't say million. I said trillion. People make money off of black people's health. We eat the junk food, or I hate to call it food, we eat the junk they sell. We get diabetes, we get high blood pressure, we lose our kidneys, we get dialysis, we amputate our legs, and we keep doing it over and over. No one's teaching children. If you saw a snake and it's called poisonous, you would not let that child pick that snake up. But they get a food and they call it junk, and we let our children eat it.
And this is East Harlem Community Radio. The program is The Wisdom Table, and questions from the Wisdom Table.
Well, that presentation on diabetes, it floored me.
Me too.
And I just wish I could sort of capture it, your entire presentation, and put it on another something so I could carry it with me. I'm hoping my
yeah, we did capture it.
Well, yeah, I'm flattered, but this information, and the sad part is, the mis, or MIS, bad information, the misinformation is intentional. As long as we can keep people unaware of the cause of things, we can keep them unaware of the solution for things.
But
If I told you that if you had a salad every day, and you made sure there was at least some raw turnip, a nice slice of turnip, that you had at least one broccoli floret cut into small pieces, and you ate that for lunch, that you could prevent stomach cancer, colon cancer, and breast cancer. That's a simple solution.
Go
But the
over that.
grocery stores in most neighborhoods won't have those ingredients available.
Go over that again.
Yeah. The raw
If you had a very simple salad, and the vegetables I'm identifying, if you want to research what I'm talking about, a turnip, and many of you on the wisdom table I think will know, that's a root vegetable. It's like a carrot. It's like potatoes. It comes out of the soil. But the reason a turnip has that little bitter taste, the family like a turnip or a radish, again, you're pulling it out of the ground. That little bit of afterbite or bitter taste is exactly what attacks cancer cells. It's exactly what boosts your immune system. So if you're saying, what is a natural food I can eat if I have a runny nose all the time, or somebody told me I have early cancer, or they got a colon polyp out, I will tell you, go to what's called the crucifix. The crucifix would be cabbage, broccoli, radishes, turnip. And if you pause and think about it, those are the foods of country black folks. I mean, in the South, everything we had in the winter, we got out of our garden. We never had the money to go to the grocery store. So these foods that we ate when we were bad and worse treated and had no medical attention kept us healthier than what we do now. Why? Because we eat the non-food. I went to college, I never had a McDonald's hamburger. I certainly didn't eat chips and puffs. And when I was telling people, they were saying, well, let's go to IHOP. And I was saying, what is that? And they looked at me and said, are you an American? You grew up in America? And I reflect on that now, brother, and I smile and say, my parents did good. I did not grow up eating pizza and hamburgers and cheese puffs and all this other stuff, and consequently, I developed a taste for what is good food.
That's right.
So children today, you say, well, we're going to have steamed cabbage, and they'll make a face. Or if you say, well, we're going to have a salad, on your salad, we're going to have shredded carrots and some radishes and some turnips, many of them wouldn't eat it. I've watched TV where now they've come up with this tool that you can spiral. You make your vegetable look like a French fry so you can get children to eat it. And I'm laughing. So I have to put a spiral radish or a spiral turnip or mix it with something else for someone to eat it. But the bottom line is, the foods that keep us healthy, we consume the least. And those foods include raw, root vegetables. And root, I mean carrots, radishes, sweet potatoes, anything you're pulling up out of the ground. And if you are knowing who's planting, you should know what nutrition is in the soil. Because if you have bad soil, you are not going to get nutritious fruit. And if you go to most grocery stores, the the vegetables you get they picked them while they were green, which means Mother Nature hadn't finished with them, and they ship it across the country. So if you can find someone who has a co-op or a farm, or you can visit that farm, or you can talk to them about what soil they're using, they found in diabetes, most people have what's called a chromium deficiency. They found in prostate cancer, most of the men have a selenium deficiency. And you were saying, well, why would that happen? Because the soil now is no longer rotated the way my dad and my grandfather would do. So if you've ever seen them, they'll tell you, oh, put cinnamon on your food and take a chromium pill and you won't get diabetes. All they're telling you is give back the deficiency and the symptoms of this condition will no longer be there. And selenium, by the way, the highest selenium food known to man is a Brazil nut. How many people about Brazil nut?
Say it again.
The Brazil nut.
Yeah.
Brazil nut.
They used to call those nigger toes.
Yes, ma'am. I knew what they used to call them. I'm going to sit down here and you knew what they were called nigger toes.
Right.
And what is it that they do? What is it that the Brazil nut do?
Well, let me tell you where I got my last Brazil nuts. I ordered them off of Amazon. I ordered a 4-pound bag. I think they cost something like $16. They had already taken the shells off because the hardest thing about a Brazil nut is the shell.
Yeah.
But the good news is 2 nuts a day will give you your recommended amount of selenium. Did you hear what I said? 2 nuts.
2.
Not a handful, not a dozen. And I like to taste, so I'm at risk of eating more than I have to. But I ordered mine from Amazon, and they came quickly because I think I'm an Amazon Prime. And I think I got 4 pounds. I may be at a point where I need to order some more. I keep it refrigerated because Brazil nuts have a lot of oil in them, and you don't want it to go rancid. Because if you know about any kind of oily nut, like pecans and others, if you leave them out and they go oxidizing, they taste terrible. But selenium, and then you asked about prostate cancer, Brother Leroy. A man that eats Brazil nuts will be reducing his chance for prostate cancer.
The man that eats Brazil nuts will have nigger toes.
He'll have his nigger toes back. He'll need to curl his nigger toes more.
That's right.
I couldn't miss that opportunity. What about Wisdom Table? She just, oh my God, you said nigger. But anyway.
Big guy. Not girl.
That's what they call them. I remember going to the store and hearing someone say, do you have a pack of nigger toes? I heard that in North Carolina.
Hey, listen, you started to run because you knew that was a home of lynching, and they may have had somebody's body left over, so you ran out that store. But listen, I worked at an ad agency. They had this big dictionary. So one day I looked up the word nigger, and the thing that, and this wasn't recently. This is back in the late '60s, and that dictionary, the listing of nigger was so long. Nigger this, nigger this, nigger this, nigger this. I said, oh man, nigger. It had all these different niggas. So I'm always telling people, go when you see a thrift shop, get the oldest dictionary, and you'll find more words in there and understanding that you will somewhere else. But Sister Shirley and my sister, you had questions.
Mine was with the diabetes.
Yeah.
Why do people say you inherited diabetes?
They do.
You got that, Doc?
No, I missed it. What was the question?
Why do people say you inherited diabetes?
Oh, okay, well, let's talk about it. There are 3 different types of diabetes. The most common one we hear about in everyday conversation is type 2. And we'll not talk about type 2. Let me go to the other 2 that they seldom hear about. The type 1 was once called juvenile diabetes. Now, juvenile diabetes is clearly due to a person's pancreas not producing insulin. Now, there's all kinds of theories why that pancreas would not create insulin, but they must take insulin injections. If they do not take insulin injections, they die because their body cannot make insulin. That is called type 1 diabetes or juvenile. And you may see on some things they said, do this and this unless you have type 1 diabetes. So type 1, some people believe it's genetic. Some people think it can come from viral infection of the pancreas. I've never seen where anyone definitively said why you get type 1. But this is the kind of diabetes that children, when a parent says, oh, my child got diagnosed with diabetes on 3 years old, they're generally talking about type 1. Now, some people can get injured. If you go to war, you get shot in the belly, and you damage your pancreas, you can develop type 1 diabetes. Why? By definition, you cannot make insulin. So type 1 diabetes is any situation where the pancreas, whether it's missing, removed surgically, or you were born with the ability not to make insulin. So that's type 1. The person who is a type 1 diabetic is usually very thin, they have some digestive problems, but they absolutely must take the injections, not a pill. They must take the injection in order to live. So when the primary treatment for type 1 diabetes is they put the insulin pump on them. So if you have a child that's type 1 diabetes and they're too young to give themselves shots, and you don't want to give them shots, you can have an insulin pump inserted. So that's how the insulin pump got developed. It was developed for the type 1 diabetic who they cannot live without insulin. Okay, there is another type of diabetes that's caused by head injury. And this one's called diabetic insipidus. It can, when you, for instance, a situation, the child born normal size, plays baseball, gets a hit in the top of the head. 2 weeks later, this child is very sick, rushed to the hospital, and they find his sugar is over 600, and he is urinating. You can't hold his urine. It is likely that this child has diabetic insipidus, and we treat that with a whole nother process. They call
Charging.
Because sugar is hard to regulate in this patient, and they have a problem with frequent urination. So those are symptoms we had attributed to diabetes, and that's why they left the name on there. They call it diabetic insipidus. I would have called it something else, but it is due to a head trauma. So there are 3 types of diabetes. The one most people are aware of, and the one that most Americans become saddled with, is type 2 diabetes. And that is associated with obesity and old age. And that is now being recognized as the outcome of inflammation. So type 2 is because we're eating what is not food and our body reacts to it, and one of the reactions is uncontrolled sugar.
I want to go back on that. When you eat the wrong foods, it causes inflammation, and one of the results of the inflammation on in this case on the pancreas.
When you eat the non-foods, the EDTAs, the benzoates, the different dyes, the body has no way of digesting it. It can't digest it. So some people's body might store it. And if they store it in the liver, you would have problems with jaundice. You may have a bloated belly. You may have nausea. You may have reflux. And that's because the body's trying to get rid of this non-food. Some people may have irritation. It's like if you know about road rash, when you have ever fallen down and you don't get a deep injury, you just kind of take a hide off your skin. That's really painful. Well, in the gut, some people react to non-food in that way. The surface mucus, which protects the gut, gets rubbed off or gets turned out. It irritates it. So you'd have these long stretches inside your bowel that is painful. And people would have crampy diarrhea.
Charging.
Bloody diarrhea. They might have a lot of gas. The belly might bloat out, or you put on clothes and it's not comfortable. You may go to sleep and wake up and just keep belching and belching. That would be a reaction that your body has to a non-food. And I've heard people tell me, every time I eat Cheetos, and every time I eat Doritos, and I just look at them and say, okay,
charging.
Don't diagnose it. There is something in those junk food packaging that your body cannot digest. So why are you still eating it? That would be, I would come to you with a Brillo pad and start scrubbing the back of your hand and it bleeds. And then I go away. And I show up next 2 weeks from now and you let me do it again. Why do we do that?
What's happening in the body for it to be belching? Okay,
it's a number of things. Belching can mean that so you have some healthy bacteria. What you hear about all the time when they're talking about your biotics. That's the new thing you hear on TV. Drink this yogurt, eat this yogurt. They'll give you healthy probiotics. Well, we do have a group of bacteria which is known as healthy biotic bacteria. And this biotic bacteria is what makes us healthy. And when I'm talking about eating organic or natural foods, really you are feeding, in some cases, this healthy bacteria. You're letting them flourish. You get a full flora. But every time you take antibiotics, every time you eat junk food, you are killing off the healthy bacteria. Once the healthy bacteria is dead, you get what's called opportunistic bacteria. Now, I hope no one has known this, but you can go to a hospital and say you have pneumonia. They give you IV antibiotics and whatever. And then you've been there for 10 days and you go home and you start having diarrhea, you start having bloating. What has happened is your non-healthy bacteria, which you will see when you go to the bathroom and you poop, the bacteria that comes out of your body is the non-healthy stuff. Your body knows how to flush that poopy bacteria. But when you take antibiotics for a long time, or you eat a lot of junk food, this poopy bacteria can overgrow. It can become the dominant thing in the gut. First it's in the colon, and it'll start moving upward. Well, when the poopy bacteria is dominant, when you got more of it than you do healthy probiotics, you will find yourself having bad breath. You will have a lot of bloating. You will be belching. And some people will pass a lot of gas. And they usually can't control it. If you're in a car or if you're a bed car, it is bad news. And this person can be embarrassed, but they can't control it. And the reason is they have an overgrowth of what we call fecal bacteria, and your probiotics have been killed off by one way or the other. And if you haven't taken antibiotics, it's based on what you've been eating. So you can, as they say, eat the wrong food in that if you eat pizza, you'll be up all night because you'll be full of gas. Then you just answered your own question. Your body probably does not tolerate the tomato sauce, or it doesn't tolerate whatever kind of cheese was on that food. So it's very important that you understand what is healthy and what is not, because your body will let you know. And some people can be like that for tens of years. I mean, they can just say, when I turned 40, man, you said, what are you doing today? I'm farting around the house. But they didn't really mean that. They are just farting around the house.
Oh,
Listen, the wisdom table is straight with no chaser. You understand what I'm saying?
well, all these years, the doctors had me, not only the doctors, other people too, had me to believe that diabetes was somebody in your family before you had to have it in order for you to have it.
No, ma'am, absolutely not true.
Then, when I first found out that I was diabetic, that was the first thing the doctor told me.
Well, here's the problem, and I recognize your voice. When you are someone who can't analyze your information, people who don't want to take the time want to give you an answer that you can't go and refute. See, I know you are a thinking person. So if I give you information, I will tell you where to go and find it, because I want you to come back and say, that's not true, I read it, and this is what I think. I enjoy that discussion. But if they tell me I have to see a patient in 15 minutes, and I need to get you moved out of my office, when I answer your questions, I'm going to always give you dead-end answers. If I tell you it's genetic, you can't go research and find anything and come back and talk to me. But if I tell you it's an inflammatory process, and I start to explain the inflammatory process can be caused by what is in Cheetos and what is in Doritos and Lay's potato chips, and I make a recommendation that you eat raw cabbage in a slaw, or you eat turnips, or you eat radishes, you can go off and talk to others and get other information. Next time you see me, you can engage me again.
Right.
But if I give you a pat answer, it's because your grandmother had diabetes, you can't say anything.
That's terrible.
And you will go on about your business, and I don't have to think about your questions anymore.
And then I believed it
And
too.
that's exactly what happened.
Yeah. And he also told me that if I lose 15 to 20 pounds, I wouldn't be diabetic anymore.
Okay, let me break that down to you. When I told you diabetes is a result, notice how I'm saying that, it is a result of something.
Mm-hmm.
If you do a lifestyle change, you change what you're doing, you will get a different result. So one of the things they found that if you lose weight, and it's usually 10% of your body weight, if you weigh 200 pounds, you lose 20 pounds. That change will change the result of how your body metabolizes your food. He is really echoing what I'm telling you. If you change what you do, you'll get different results. So whatever you have to do to lose the weight is exactly what you need to do to stop the inflammation causing diabetes.
Okay, okay.
So if you change what you do, you change your results. They don't tell you that clearly. They'd rather keep it mystified so you'll still be taking pills.
Right.
But it is truly a lifestyle difference when you're talking type 2 diabetes. If you change what you do, you will change your results. And diabetes is known to be a result. It is not a disease in its own cause. Type 2 diabetes is a result of being heavier than you should be, and we might need to talk about obesity, because obesity treats you put on new hormones in your body and your brain when you're more than 30 pounds overweight. You literally change hormones in your body. The presence of excess weight.
Okay, all right.
So yeah, if you change anything, you'll change your outcome, and diabetes is an outcome.
Well,
So that's why you hear them talk lifestyle stuff. It is worth, if you're saying, okay, I weigh 150 and I'm going to lose 15 pounds, or I weigh 180 and I'm going to lose 18 pounds, definitely you will affect inflammatory processes. So you should also know that reflux, GERD, is an inflammatory process. I don't know how many of you watch TV, but if you remember, they used to have the purple pill. The purple pill had all these commercials about Nexium.
Right.
You see that went
Yes.
off the TV, right?
Yes. Uh-huh.
That's because a group of doctors challenged. They said, you are telling people they need to take a pill to prevent a condition when they shouldn't be getting that condition in the first place. And they had to pull it. They got sued.
Oh, what was that? Sorry.
Because GERD is not a natural thing. It is a cause. It is a result. You get GERD as a result of something you do. And for them to be telling you, go out and buy Nexium and take Nexium and you won't get GERD, they're lying to you. You don't get GERD if you don't do some bad stuff, like don't be eating in bed after 10 o'clock. Don't be eating pizza for every meal. You don't have to get GERD. But they imply that if you took Nexium, that's how you prevented GERD, and that's
Which was a
false.
lie.
And that's why they pulled that commercial. They got sued.
Now, I want to go to Dr. Oz.
Yeah.
From what I read, he came up with this particular medicine that you only take for a certain, maybe a couple of months. You won't have diabetes anymore. Then I read someplace else that some doctors were challenging him by saying he was wrong, he didn't know what he was talking about, this, that, and the other, and this, that, and the other. And then I read some of the comments of people that was taking that particular medicine. Well, from what I gather, the medicine does work. But I'm kind of scared to take that chance.
Well, see, again, what I really, and I really respect this show, by the way, brother, and I appreciate the wisdom table. Never look at medicine as working or not working. The thing that works is your body. If you ask me a question, does this medicine work, you're going to hear me answer the following. The medicine can reduce inflammation. I think you're talking about the ketogenic diet.
Yeah, that's it.
Does the ketogenic diet work for diabetes? My answer is the ketogenic diet can help lose weight effectively. And it is known that
There's no.
Powering off.
No, we still connected. Doc, can you hear me?
Powering on.
Doc, can you hear me?
You might have some pharmaceutical company that
Hey,
Start all over again.
Yeah.
with the ketogenic. If somebody asks you about the
Ketogenic
ketogenic,
diet, yeah.
you would.
the ketogenic diet. My answer is yes, it does effectively help you to lose weight.
Okay.
And the loss of weight has been shown to change the outcome of diabetes. If you lose 10% of your body weight, you can cure the need to take supplementary medication. Now, let me give you a caution. Ketogenics has a meaning. It's K-E-T-O, keto. Ketogenics means you are putting your body in a state where it prefers or it will break down fat rather than sugar. Now, let me caution you. If your current state, if you've lived more than 60 years, we have all kinds of conditions due to the way we treated our body. If in your current state you have any problems with recall or thinking, and I guess I would say if you're taking medications for any kind of pre-alzheimer's or you're concerned about your memory, you would need to go through what's called an adjustment period for ketogenic diet because the brain prefers glucose over every other process. So even people that are intentionally doing ketogenic diet, let's just say a 21-year-old healthy person, they will have at least 12 to 24 hours of what's called dullness. Your brain will not be happy that you are going into ketogenesis. You'll have headaches sometimes, you'll be more sleepy, you won't think as fast because the brain wants sugar. And if you've had type 2 diabetes for a while, your brain will want sugar more aggressively than, say, mine. So if you're going to go into a ketogenic diet, make sure you are aware you should drink lots of water, and you should plan to be in your most safe environment. I tell people start it on a weekend and sleep in. You may even cancel going to church or your religious ceremony that week because your brain is going to have you a little bit daffy. Somebody's going to accuse you of drinking several glasses of wine, or you're going to be walking around looking for your glasses when your glasses is on top of your head. Because ketogenic state is by definition a process by which the body does not use a lot of glucose, but rather starts to burn fat. And your brain prefers glucose. So just know you can go into a kind of dullness that could last up to 24 hours.
Okay.
So you need to be aware. So if you are a heavy equipment operator or a nurse,
Incoming call.
Hold on.
Uh-oh, somebody calling.
Ignore it.
No.
Somebody's calling him. Somebody incoming call.
Can you?
Can you see?
I'm messing with that pill.
and after 2 days of not really eating that much, you go in to talk to them and they seem like they're not themselves. It's not the pneumonia necessarily. It can be a drop in sugar.
Could you spell ketogenic for me?
Ketogenic. It's kinetic or keto, and I'll spell genic. Ketogenic.
Okay.
And it's expensive, $329.
Well, they call it the keto diet, and you take 2 pills a day, and what it does, it helps the body prefer to break down fat. And anytime you're breaking fat down, you're going to lose weight.
Yeah, absolutely.
But the side effects is, as I'm telling you, if you have any problems with your kidneys, I should mention that, a ketogenic diet will make you pee, 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 pee. So you want to drink lots of water, and if you are for any reason taking Lasix or anything else, you might want to talk to your doctor about stopping it. Because a ketogenic diet, stop it as long as you're on the ketogenic diet, unless you have a bathroom very available.
Okay.
Now, Dr. Boles,
I'm thinking.
Yes.
you mentioned reflux when you were talking about Nexum, but I didn't get that.
Yes, GERD, which is Gastro-Esophageal Reflux. They made it into a big deal about 5 or 6 years ago, where they were doing all these commercials on Nexium and the purple pill. Reflux is simply the acid in your stomach comes up into your chest when you lay down. That's why when you're in bed and all of a sudden you say, oh, I have so much heartburn. Some people experience it as heartburn. Some people experience it as pain. It usually occurs at night because that's when you lay down. And we had gone through all kinds of things like don't eat after 6 in the evening. Don't lay flat. Lay on an inclined pillow. But the bottom line is we should have
Charging.
children should not eat. But before we go to that, if you are more than 30 pounds overweight and the fat you have is around your waist, in other words, if you have love handles, this excess fat actually pushes your
Charging.
air such that it can leak into your chest. So the first thing, why can you get GERD? It can be overweight. That's your first problem. The second reason you can get GERD is you eat late at night and lay down immediately. The third reason you can get GERD is that the muscle between the bottom of your esophagus and the top of your stomach has become relaxed over time. And sometimes medicine can cause this. So you may be on a muscle relaxant and you never had GERD in your life. But after you take that muscle relaxant, you get a heartburn. That's because that relaxant is allowing the muscle between the esophagus and the stomach to be relaxed. So there's a number of reasons to get GERD, but each reason has to be addressed. What they were doing on television was making you believe that you should take a pill to prevent GERD, when the bottom line is none of us should be getting GERD in the first place. And we went after them saying, why are you making people believe if they buy and take Nexium that they are protecting against something, when the reality is Nexium is meant to treat the condition, not to prevent the condition.
Wow.
The lifestyle change prevents the condition.
Yes, lifestyle is what prevents it. Lose some weight, don't eat late at night, don't eat certain kinds of foods. That's what prevents it. But they were giving you the impression you need to be taking Nexium and that'll prevent it. And that's what we went after. How are you telling people a pill is to prevent a condition rather than the treatment of the condition?
The industry, not only that industry, but anything attached to industry, and I'm saying anything very loosely, thrives off of the lack of knowledge of the majority of people.
That's right.
So that...
Well, another example, brother, is look at milk. Remember they had that commercial about Got Milk? And they had Spike Lee. They even had the Williams sisters. They had Shaq, all of them doing that milk on the upper lip. We took them to court about that. Because milk is not a natural food for an adult. And in fact, there are people who have lactose intolerance with time, and guess who are the worst. Black people. We cannot drink milk past the age of 35 to 40 because it gives us gas, it can give us diarrhea, it has been known to cause ulcerative colitis, and here they had prominent black athletes advertising the concept of milk. And we sued. We said, you are knowingly telling people to drink something that you know will hurt them. And they had to pull that commercial. You don't see that anymore.
No, you don't.
No, we took them to court. Because they were simply making money knowing they were creating harm.
You said we took them to court. Who took them to court?
The American Medical Association.
Okay.
Yeah, I keep in touch with MMWR, which is the Monthly Mortality Weekly, which comes out of the CDC out of Atlanta. And it talks about diseases and the potential for diseases. And those of us who are what we call advocates can write into the various associations and actually complain. I mean, my name, if you say Dr. Boles at the NIH or at Bethesda, they know who I am. They don't like me, but they know who I am.
What's that? The NI? Okay.
NIH, which is the National Institute of Health in Bethesda, Maryland. They're one of the watchdogs, or supposed to be one of the watchdogs. The FDA is another group that is supposed to be a watchdog for us as far as what we eat and what can harm us.
Well, one thing I wanted to say about Dr. Oz.
Yeah.
I heard this somewhere, but he used to be with Columbia Hospital, Columbia Presbyterian Hospital. I think it has another name, but a big hospital in New York. And he was thrown off the board. He was thrown off.
Well, they went after him. I don't know the whole story about Columbia.
Yeah.
And I spoke to Brother Leroy a little bit about this. They went after him when he started his television show because I think Dr. Oz's primary was surgery.
Yes.
And a lot of what is covered on his show would be internal medicine. Now, the regular people wouldn't necessarily know that, but I know it. And what they said to him is, how are you getting information outside of your specialty? And that was a way in which they could attack him. Now, I don't know if there were consequences to that or not, but I did know they went after him. Because what he talked about is not what he majored in his residency.
Right.
And I always tell people, I said, an MD is an MD. Residency is what you chose to get your mix at.
Right.
But if you go to a school and you get your MD, we should be learning all the same information.
Yes.
I had a question, Dr. Boles.
I don't know the whole. Well, did you know that they went after Dr. Phil also? He lost his Texas license behind his helping Oprah. How many years? I think it was like 15 years ago or something like that.
Yes, yes.
So all that means is the watchdogs control us. And I was even talking to Brother Leroy about this because a number of people who want to keep things a certain way can decide you got to be a member of this board, you got to be a member of this society. And when they want to discredit you, all they have to do is say you can no longer be a member of this society. They're doing that doesn't make you less smart.
That's true.
It just tries to give you a worse reputation. They're hoping people won't listen to you if they declare you are no longer part of them. But too often, them are the very ones hurting you. And that's how they control being spoken out against. That if you say something bad, we won't let you be part of our group, and we'll let people know we threw you out.
Yeah.
But what the people have to be aware of is, was that person thrown out because they're trying to help me?
We have a question.
Yeah, Dr. Boles, speaking of controversy in the medical field, I had a question about, I've heard a lot about the effectiveness of cannabinoid oil in the treatment of some cancers. Can you comment on that?
Yes. Any low-fat oil, and I do know the oil you're referring to, cannabis First of all, if you know the history of cannabis in the United States, Native Americans and East
Charging.
using cannabis for health reasons for centuries. Cannabis got an ugly name because an uninformed CIA agent decided. This was a decision. This wasn't a medical decision. This wasn't a medical proof. It was someone to put it on the drug register as a controlled substance, period. That's how it happened. Nobody did it medically. It was done by someone who had the authority, but it was acting outside of their field. Cannabis oil is an exceptional cell regenerator. We talk about, they made money, a lot of money on what they call the regrowth hormone, and they went on and on. This is when I was in medical school. But the truth of it is, Native Americans, Eastern medicine have been using cannabis, the actual plant leaves, the plant stem, the plant root, and they would grind it and mix it with bear fat or deer fat or whale fat, and they would rub it onto any kind of an injury. It had an antibiotic type action, that where some people can get gangrene and have an amputation. They would have cases in the Inuit, which is an Eskimo population, where they would have been bitten by something or gored by something. This is a deep wound, and in Western medicine, I said a good 80 to 85% of the time it needs an amputation. They would simply pack it with these various oils and oil concoctions, and this person would heal normally. So this is not new news. This is just marketing. Is cannabis good for you? Yes. Are these lighter oils a digestive food for you? Yes. Can it heal cancer and other cells? Yes. The spice thyme, Thyme, if you're familiar with the song about sage and thyme, thyme comes from spruce trees and pine-like family. And that oil has been antibiotic, and they've known about it forever. They've used it for cleaning of wounds in a circumstance where you are going to do surgery or you have to do something and cleanse the area. They use all kinds of natural oils, orange peel oil, lemon oil. That's how you find them in your different waxes on furniture. It was first used in a medical sense among the alternative medicine people. It's westernized medicine that chemicalized everything. They took the plant part out of it. Aspirin is the bark of a tree. And Native Americans would go and take the bark and chew it when they had a headache. Western medicine came and put it in a powder, pressed it into a peel, and most people don't know the source of that. So to answer your question, and the short answer is yes, it does have anti-canceral properties, and it always has. It is simply that the marketing of pharmaceutical companies in America makes it sound like you must take their prepared chemicals or it doesn't work.
Thank you.
Wow. Aspirin come from a bark of a tree.
We're running down on time. When people have polyps removed from their colon, talk about that situation.
Okay, it's still on point when you're asking about the irritations of eating junk food or non-food. When you wear a shoe and it doesn't fit, you'll first get a blister. If you keep wearing that shoe, you'll get what we were calling a callus or a corn. And usually, if you're familiar with the corn, it's a raised tissue, it's a bump, and that corn becomes a problem because now you put a shoe on, it will change the way the shoe wears, and they will even put a lump on that shoe. I can remember going to church and seeing these old women, these high-heel shoes, and the shoes had these lumps on the top. And you look and say, oh, that woman got a bad corn. Right. Well, the same thing is with the gut. If you continuously give it this irritant, let's say I love Cheetos, and I'm eating it, and this orange dye in this non-food irritates that bowel. The first thing that happens is the mucus on that surface will increase. It will secrete more mucus, and that's why you can get loose stools or diarrhea behind eating the wrong food. Then, if you keep eating it, you're going to use up all that mucus production possibility, and it's going to become an irritant. And that's what I meant about road burn. It's not like somebody cuts you, but it's like the surface is eroded and it's painful. That's when you can have cramps, or you can have, oh my goodness, I ate the wrong thing, you have bad cramps, or you can hear your stomach talking. We say stomach, but your bowel's talking to you. You may not have diarrhea, but that food gave you that reaction. Okay? You continue eating it. The next thing the body's going to do is what it knows how. It's going to build a callus. And as it builds that tissue in the place that it is most irritated, it is referred to, if it grows in your bowel, we call it a polyp. But it's the same mechanism of when you get corns on your feet.
Wow.
So, what reason do they give you for recommending that they be removed?
I was waiting for the question. I didn't want to keep talking. I want everybody to listen and get so see it. Okay, so you got a callus. That means that there's a possibility. Let's say that you eat a big dinner. We just had turkey dinner. And you got a big bowel that you make. And that bowel movement is urgent. You had turkey and you had dressing, and you go to the bathroom. What happens is that big load that comes out of your body will pull the top or scrape against this callus, which is your polyp. And if I do that, you're going to get some bleeding. And that's why they check your stool for blood. And if you keep injuring this polyp, and keep in mind it's sticking up in the way, you will constantly keep it with an open injury. Well, anything that is constantly eroded or injured, the body will try to fix it. How does it fix it? It keeps putting more tissue on top of it. The definition of cancer is multiple out of control growth. So if I have a polyp that keeps getting injured and I keep trying to fix it, I'm going to start growing a precancerous site.
Okay. All right.
Yeah.
So if you take the polyp out, you stop the reason for the injury, and the chance of there becoming a cancer there goes down 1,000-fold.
I'm going back to the diabetes. You stop the result.
Yeah, if you change what you're doing, you'll get different results. So if you stop gaining weight and start losing it, you'll get different results. If you stop eating junk food and start eating real nature's food, you reverse diabetes. Why? Because you're getting new results. Diabetes is the result of digestive irritation.
And the polyps are a result of...
As a result of a chronic injury, that you're eating something that the bowel is trying to fix. It's going to first give you a lot of mucus, and that's your gas, and that's your loose stool. And if you keep on it,
Charging.
building a callus the same way your toe will build a corn.
Okay, so you leave us with a quick overview of prostate cancer. What prostate cancer in black men, what they don't know but need to know, and when was it known that they needed to know something that was being misinformed to them in the first place?
Number one thing, blood test. Get a PSA. I'll repeat it. It's called prostate steroid antigen. But all you need to know is the letter P like Paul, S like Stephen, A like Apple. A PSA should never be higher than 0.4. If it's higher than 0.4, your doctor should either send you to a urologist or a specialist so he can do an evaluation, and it will be a dye injected in such a way he can see your prostate. So I've had people tell me, my PSA was just number 1. If your prostate is a 1, it's 2.5 times too high. So you want it under the number 1, and don't let somebody tell you, don't worry about it. It's just, if it's higher than 0.4, you need more evaluation, and you want visual. You don't want someone sticking a finger up your butt. That's ineffective in black meat, unless you like them. Anyway, the second thing you can do is selenium. The highest known source of selenium, because there's other foods that have selenium, the highest known source on earth is the Brazil nut. So if you are serious black male who's gotten a number, say, I had a 1.2 prostate, and they said it wasn't a problem, they said it was enlarged, then I would start eating Brazil nuts. You can eat as few as 2 nuts a day to nourish that part of your tissue, not to develop into cancer.
The so when you say the sticking up the finger,
They
that
are palpating the interior lobe, and the number one cause of cancer in black men is the posterior lobe of the prostate. So if they're doing the digital, we won't say finger, the digital exam, they can only diagnose less than 10% of the type of cancer that kills black men.
okay,
So instead of the digital, what do you use?
the PSA.
You will have a blood test. You allow them to take blood out of your arm,
Oh.
and they do a level of PSA. That's an enzyme that they measure. When that enzyme is high, it means that cells inside of your prostate are reproducing, and that's not desirable. When they are reproducing, that means your prostate is growing. And when you get a prostate that's growing, it might not be cancer, but it's a high chance it is cancer causing that rapid growth.
So it's not the digital exam, it's the, I kept missing that.
PSA.
Well, now, no one should be telling a man they're going to do a digital. It is the golden standard. Now, I'm going to quote this out of the book. The golden standard for diagnosing prostate pathology is PSA level.
And that shouldn't be over 0.4.
And it should be 0.4 or lower.
And how do they take your blood? Just from your arm or?
They can take it, when they do a red top, and that's the most common blood, when they say, I'm going to check your enzymes, your liver enzymes, they can also do a PSA. They don't have to do a separate, any color. Used to be they had to draw a lavender top or something else. If they take a red top, and that's the most common blood, then they can test everything they need to test. That includes your endocrine panel. We haven't talked about thyroid and whatever, but the red top tube of blood, they can test anything from that tube. Now the difference, the reason I'm telling you that, and I should ask why is that, different colored top tubes are treated with different chemicals. They pre-treat the glass inside the tube, but the red top, big red top tube has no treatment. Therefore, you can perform any test from red top.
Okay.
See, if I were going to, as a pathologist, if I was going to try to find out why did this person die, and I want to look at did they have a drug or whatever, I might use different top tubes to draw the blood because I don't want to lose or get a reaction from whatever I'm looking for, and that's why you have the different color top tube. But just general blood draw should be a red top.
One of the things with the PSA, according to what I understand, and this is from reading, and that is the straight up PSA test. One has to, on the more definitive side, have to get a series of PSAs to see.
Well, if you walk in and you're 20 years old and you ask for a PSA, they might argue with you because we are taught that we look for things when you have symptoms. So let me back up. If you are first over the age of 40, that allows you to ask for a PSA because it can be an age thing. If you have frequent urination, if you're running to the bathroom, you can't get through a ball game, or you have an urgency so bad that it almost puts you into tears. I had one man tell me, it hurt so bad I just couldn't hardly hold it. And then I go and I hardly have a scream. Those are symptoms of the prostate being bigger than it should be. If during sex, if ejaculation is painful, if it feels like, oh my goodness, something is hurting me, we're going to check you first for kidney stone, and second, we're going to check for prostate. So there are some symptoms that should make your doctor quick to do a PSA. If you're over 40, and if you have any what we call urogenital symptoms, frequent urination, coach starting and stopping your stream. In other words, you stop peeing, but it keeps dribbling. Or you go in there and you're trying to start your stream and it's hurting you so bad you can hardly stand it. Those two symptoms are usually prostate blockage. So if you have, or in third one, like I said, pain with ejaculation, that if it's not pure pleasure, there's something wrong. Sometimes it also can be a difficulty holding an erection. You can get the erection and you think you're ready to go to business and boom, y'all, everything stops. And no amount of stimulation can reactivate erection. And that's erectile dysfunction. And that also can be due to an enlarged prostate. So if you have symptoms, or if you're over the age of 40, you should be able to walk into a doctor's office. Now, if you have the symptoms I described with pain and other things, they'll do other tests as well. They may do a urinalysis to see if you have a urinary tract infection. They may check you for gonorrhea, chlamydia. They will probably check for stones, but definitely they will check for prostate enlargement.
Okay. As I said in the beginning, we always have problems getting through to you, but you passed the test today, sis.
Let's give her a hand now, but she did real
Yes,
good.
thank you.
Sister Dr. Velva Boles, boy. Oh, God bless you and your family. Thank you very, 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 very much. Wow. We're going to have to get this one up on the internet quick. This is, no, hey, it is a classroom.
No, it's a master class.
Yeah.
Man.
That's what kept up. That's what is entering my mind. We send some of these to our friends, you know. And I really would like to, a friend, I have a young man friend who's a teacher, and his brother-in-law fell out after Thanksgiving or Christmas. And he's diabetic, and he's trying to change, but I think this would be a great what do you call these things?
Gift?
A gift,
Right.
but you know what I mean.
Tutorial, learning tool.
A learning tool for this gentleman, because I think he's ready. These are young men who are ready to listen and travel. And I wanted to know, are you seeing patients in your town?
Well, I don't have an active patient list. I've had some what they call unusual cases they've asked me to consult with, but I have not maintained an active license. I had one in Missouri, one in South Carolina, one in Louisiana, and that's required when you have office hours. But as a consultant, I'm not required. I can certainly consult or be on an advisory board or provide information for anybody at any place. And I'm recognized at several hospitals and locations, but I do not at this time have a list of private patients.
Mm-hmm. If someone lives in another town, let's say.
Well, I have traveled. The reason I mentioned the panel, the way in which medicine is, and I told you it's kind of like a closed society, you are accepted or you're not. Because I have worked with lupus, I've worked with hematology. I was a medical director for a while at a hematology producing plant. It was actually making the fluid that we give people who are hemophiliac. I am required or requested to come and give my expertise when they're about to do stem cell transplantation, when they're going to give people transfusions with stem cells. I've worked with people with multiple myeloma, the oncology department. I've worked with some cancer centers. And when I go, I'm acting in the capacity of a physician scientist, because I'm an MD, PhD. So I can talk to them about the science of the cells, as well as, for me, to keep up with the clinical discussion. If it's Western medicine, it's often the pharmaceutical companies who come in and their medicines, and I don't agree with that. I think diet, spiritualism, people's belief system, and all kinds of alternative things can work equally well.
Okay.
Yeah.
Okay.
They the last thing is a statement question that it's through their studies, they have found that prayer works. Prayer does work or can work in the case of an ill person, whether they, in cases where they know people are praying for them, and in cases where they don't know people are praying for them. Your comment.
Well, it is proven. I can give you actually, and I'll share this with you, brother. You can share it with them because it's kind of a lengthy thing. There's a very well-known PhD who is now a spiritualistic person because he was in an accident, was paralyzed from the neck down, and he now walks. And what he said got him to the point of walking was not physical therapy and all the other things Western medicine tells him, but what he did in an alternative and metaphysical process. And being a scientist, what he does now is he goes to various healers and he measures energy of the person, energy in the room, to show that there is a separate force, which in fact is a healing force when people know how to harness it. And I have been reading him, and he's absolutely fascinating. I'll share him with you, and we may want to talk about that more. But my answer to the question is, every person has within themselves what is necessary.
Charging.
And how do you tap into it?
Okay.
So, I mean, people talk about spirituals who can lay hands on and heal. Absolutely, that's true. There's people say they can meditate, heal themselves. I say, absolutely, that's true.
Very
And
good.
I talked to you, Brother Leroy, that my grandmother was a healer. I've seen things that from a medical and a scientific point of view, there is no explanation.
Man.
Is that Dispenser, Dr. Dispenser you're talking about?
No, I got to see and others who are well known, but one of the most best known, and I wasn't aware, I mean, I wasn't there to be able to adjudicate, but Oral Roberts was one of the most famous spiritual healers in the United States. Now, whether or not he's true, I don't know. I know what is his name, Popoff. There's another spiritual. They go through religion and talk spiritual. Dr. Stevie stayed with the scientific side. He looked at how you could heal yourself from within using what Mother Nature has given us. The person I'm talking about, his name is Dr. Jenner, and I'll send information to you, Brother Leroy. He is a modern day PhD who is demonstrating by scientific method that the mind definitely can exude a power, and he's measuring that power. I mean, it's more than just hocus pocus, and people saying, "Oh, that's witchcraft." If you're asking me personally, I am a believer. I've seen too many miracles as an emergency room doctor. I'd enter a situation, see it, and I do a prayer. I'd say, God, if this person is meant to live, give me the knowledge. Reach into me and give me whatever strength necessary to keep him on the earth. But if he is meaning to go on, let me not defy your will. I said that prayer more than once.
Well, Doc, want to thank you very much, and wow. Once again, this is the Wisdom Table, and with Dr. Boles, boy, all you got to do is just say run it.
Dr. Boles, you have a program.
I am currently trying to get a series started. I'm in Lafayette, Louisiana, doing a public television program called Vantage View. The last few episodes, we've gotten 6 episodes done, and I think we have to do a minimum of 25 before we can apply for syndication. But I tell people, I'm open. If there's someone in the listening audience that want to get something started, and they think that I can be a benefit to contributing to it, I'm open to it. I think knowledge should be freely available. And if there's anything I know that can help you, it's already yours.
Your book. Mention your book as we conclude.
Salute Reaction. I did, the second edition is out. You can go through Amazon, and it is kind of three parts. The first of it talks largely about how Black people in America have been used experimentally, and now how they're used financially. Black people are the number one consumers of all pharmaceuticals in the United States.
Damn.
And we're the number one people with amputation. And we're the number one people on dialysis. And you might not know dialysis treatments are paid for by the U.S. Senate. They allocate a certain amount of money a year, and there's only 2 men who own every dialysis center in the nation.
That
So it's an
last,
inside job.
that last piece.
There are 2 men that own every dialysis center in the United States, have a guaranteed income because the United States Senate pays them to run those centers.
Well, there are other people who.
Yes, ma'am. Yes, ma'am. Black people go around saying, oh, I get dialysis free. It's like, no, it's not.
Yeah.
It's not free
It's paid,
dialysis.
okay.
It's paid by the tax people. And there's a guaranteed income that the United States Senate pays for dialysis in the United States, and it pays it to 2 people.
I didn't know that.
It is not an open enterprise. You and I cannot open a dialysis center. It is a closed enterprise, and it's guaranteed income.
Wow.
It's like a Section 8. They get guaranteed income, and the most people they treat are Black.
That's true.
Wow. To be continued, Doc.
That's true.
Okay.
To be continued.
All right, thank you so much for the invitation, and you don't know, but you're keeping me sharp. Every time I get off the phone and talk to the wisdom table, I go looking for some more wisdom.
All right, sis.
Thank you so much.
Thank you.
so
Thank
much.
you.
All
Okay.
right, until next time.
Okay.
Bye-bye.
Bye-bye.
Boy, this has
You know,
been.
I
That lady know
let me tell you,
everything.
I could go on and on.